We are going to look at the steps and protocols of spinal anesthesia, its complication and its side effects. Spinal anesthesia basics, we will be looking at injection of the spinal anesthesia should be done at subarachnoid space at L3 and L4 or L4 at L5 enter space below spinal cord. So most commonly drugs used in spinal anesthesia is bupivacaine, lidocaine or tetracaine. So what are the physiological effects of spinal anesthesia? Cardiovascular, we will look at hypotension because of sympathetic block, vasodilation and decreased venous return will be there. And then there will be bradycardia because there is a block at T1 and T4 cardio accelerator fibers. Or respiratory, we will look at diaphragm is paired and innervation is at C3 C5, so we do not need any mechanical ventilation or any other paralysis does not happen in the chest wall, so patient breathe spontaneously on its own. In CNS, we will be looking at nausea, anxieties because of hypotension. There will be a complaint of vomiting as well. So we will have to replace the fluid. And contraindication are, these are two types: absolute and relative contraindication. Absolute are patient refusal, infection at puncture site, hypovolemia, increase intracranial pressure and coagulopathy. We do not perform spinal anesthesia. Relative are sepsis, fixed cardiac output lesion, aortic stenosis or neurological disease. Complications will be early complication result in hypotension, bradycardia, spinal respiratory compromise will be there, or post-dural puncture headache can be there because of CSF leak. Multiple site puncture results into PDPH, and urinary retention can also be there. Rare meningitis will be there, or any abscess formation will be there. Factors that affect block height are porosity of the solution. There are three type of the solution: hyper, hypo and isobaric. Position of the patient, site of the injection, these all things are affecting the patient's spinal tap. So how, if patient has the hypotension, how will we manage? We will be giving preload to the patient with the fluid. We will make tilt in the pregnancy, uterine tilt in the pregnancy, give vasopressor for blood pressure controlling, atropine for bradycardia treatment. So in this way we perform spinal anesthesia. So there are different spinal anesthetic agents like bupivacaine, lidocaine and tetracaine. Bupivacaine has 0.5% hyperbaric, 10 to 15 mg per kg with the dosage. And we have to take care of the hypotension, bradycardia, and other are the block at the height, veracity, position, dosage, and site in the injection site can be also measured or monitored. So in this way, we have to do spinal anesthesia.